Good Vibes Only is here to take you on a journey to discover the weird and wacky world of wellness. It's brought to you by the globally renowned skin and wellness expert Marie Reynolds, who holds over 36 years of experience within the skin and well-being industry. Each week, Marie shares her own holistic lifestyle hacks and chats to other leading wellness experts to find out their good vibe story, discussing how they deal with day-to-day stress, anxiety, sleep, and skin issues. Listen in as Marie explores why, when it comes to our health and wellness, we need to look beyond the linear, question the norm, and think outside the box.
Today's guest is Dr. Ralph Rogers. I wanted to bring him onto the podcast to educate everybody and explain what his procedure involves. I went to Dr. Rogers about a month ago for pain in my shoulders, significant pain that was caused by rotator cuff tears. I had tears in both shoulders, but the right one had a significant tear that was causing absolute excruciating pain. Now, I was due to go in for an operation. I had the date booked, but the consultant wasn't giving me much confidence. And I remember my cousin having stem cell therapy to his knees. So I thought I'd do some research. And when I reached out to Dr. Rogers, he quite rightly corrected me, saying that it isn't stem cell therapy that he uses in his procedure. He uses mesenchymal stem cells, which are a whole different thing to stem cells. And we are going to discuss why it is important to differentiate the two and why Dr. Rogers uses them in a procedure called MFAT. This is what I had. So I'll hand over to Dr. Rogers now. I'll let him introduce himself and he can then tell us what the difference is between stem cells and mesenchymal cells. Welcome, Dr. Rogers.
Good day, Marie. It's lovely to speak to you again. I'm Dr. Ralph Rogers. I'm a consultant in regenerative orthopedics and sports medicine. I look after everyone from 9 to 90, essentially, with any kind of acute or chronic injuries. We also work in the human performance arena as well, being a part of sports medicine. I've worked with professional athletes and actually just normal everyday people, weekend warriors, elite athletes, you name it. So, and the last 15, 16 years, I've been involved with what is called regenerative medicine, which is, it's the process of replacing engineering or regenerating human cells to restore or establish normal function. In a nutshell, that's what it is. And I perform this in musculoskeletal injuries.
Yeah.
Getting to your point, talking about stem cells, there's a whole, it's a problem talking about stem cells because it's an exciting field. And just like every exciting field, a lot of people take advantage of it.
Yeah.
Now, as you know, this is one of the problems. And then there are some doctors, some of my colleagues are kind of unscrupulous and take advantage of patients and overpromise things that just are not true.
Yeah. Overpromise and underdeliver.
Yeah, so to speak. Talking about the cell that I use, one of the cells, in your particular case, we talked about the mesenchymal stem cell. This was discovered by Professor Arnold Kaplan at Case Western University in the early 90s, in fact, 1991. And he at that time thought, wow, I've got this stem cell, this mesenchymal stem cell, and maybe there's a whole lot of things that we can do with it, like, produce cartilage and all these other things. But as it turned out, this cell does not produce cartilage, bone, or anything else. And that's why when patients come to me and ask me for that stem cell treatment, I have to give them that explanation so they know exactly what we're trying to do. Let's say for people with osteoarthritis, for example, the knee, I'm not growing cartilage.
No, because I think it's the confusion where when people talk about stem cells, well, there's some controversy about stem cells using umbilical cords, which is something you don't do. No. And I know that many doctors, when they harvest the stem cells from this, they use umbilical cords post-birth.
That they claim will differentiate into various tissue. The treatment that I use, it's called lipogems.
Yeah.
Some people call it MFAT, and it was developed by a gentleman who's a very dear friend of mine, Carlo Tremolata, out of Milan, Italy. He trained me in Italy and here in London. I'm one of the first, if not the first person to do it in this country, and done many procedures for the last 6 or 7 years. I use this mesenchymal stem cell in musculoskeletal injuries. But going back to Arnold Kaplan's work, he doesn't like for us as clinicians to call it a stem cell. He likes to call it a medicinal singling cell because of where it is and what it does.
Yeah, this is why I wanted to bring that point about stem cells, that this is not stem cell therapy. This is to do with the mesenchymal cells, which is not building new things, which a lot of people get confused with.
Yes.
And there's lots of different shaded areas with this. This is completely different. It's regenerative medicine that you're doing. And we'll talk about what I've done with you and how I felt with it in a minute. But I just want you to get back to that point, because what we said, see, is that education is key.
Yes.
Education is key. So we want to make sure that both of us, that when we're talking about the mesenchymal stem cell, it is not the stem cells that people tend to think what it is. It's regenerative medicine. It's building on tissue that's already there to repair and heal and reduce inflammation. Is that correct?
I couldn't say it any better. That's exactly it. But take it a little bit further to tell you exactly what this mesenchymal stem cell, or medicinal singling cell, as Arnold Kaplan likes to call it. He says to us that this cell does act like a stem cell in a petri dish, but in our body it doesn't. Now, this cell starts off as what we call a periocyte, and it's on every vessel in our body. Okay? So when there's any kind of injury or inflammation, this periocyte comes off the vessels and it differentiates, or I shouldn't say differentiates, it secretes, is the better word. It secretes wonderful molecules for healing, proteins, peptides, exosomes, cytokines, and growth factors. And this all part of an acute inflammatory, any kind of inflammation or injury. And what it does in a nutshell, it creates what we call a regenerative microenvironment. So there's an immunomodulatory effect, and there's a trophic effect. And there's increased blood flow, there's anti-scarring, and anti-cell death. That this system, that's what happens. And this is what we do. So I tell patients immediately, you didn't come to me because you don't have cartilage, you come to me because you have pain. So this cell also binds to nociceptors, or pain receptors, also the chondrocytes, the small cartilage cells that you do have, and also the synoviocytes if we're doing something with osteoarthritis. So that's what it is in a nutshell. And I go through that pretty clearly in my consultation, because I don't want people to have this idea that we're doing anything other than what we're doing. I'm into pain and function. I want to decrease pain and increase function, and hopefully avoid or delay surgery. This is a minimally invasive, non-surgical treatment, so to speak. Minimally invasive treatment.
And everybody is different as well. You know, each of us are different in our lifestyles and our environmental factors and hereditary factors. The therapy, it's not a miracle cure. I had mine done 4 weeks ago, and it was so quick. It was such a quick procedure in under an hour. I think it was about 40 minutes. You removed the fat from my buttocks, flanks. And while it was going on, I was having a good old sing-song, a few curse words thrown in. I was having a good old sing-song, and took me back to my youth, the tunes that you were playing. It was brilliant. And then you did a procedure. So you extracted about 60 mils of fat, and then you put it through a filtering system. Is that correct?
It's the Lipogems filtering system. Other people do it other ways. There's we could talk about it another time. It's called SVF, but in this particular procedure, I use the Lipogems canister. It's a closed system where we put the fat in, and we literally wash the fat through 2 filters, and then we take the fat out of the canister and we inject it. By that time, it's called Lipogems, and we inject it ultrasound guided into the damaged tissue.
So it's done under a local anesthetic. And then you do the procedure where you wash out the red blood cells and wash the fat, and then you inject it directly into the site using an ultrasound. So you use the ultrasound on both shoulders where we could see the level
Where the
of
damage.
Yeah.
Yes.
And then you injected it straight in.
I think it's very important to stress as well that it is under local anesthesia. This is the way it was taught to me and the way that Carlo Tremolata likes to have it done. Local anesthetic, as you said, I ask people what songs they like and they sit there and sing. Some people even sleep through the procedure. So, yeah.
Yeah, it was very, very quick. I think my husband was waiting outside and he was just about to grab a cup of coffee and he just sat down and just said, have you had it done already? Afterwards, you feel a little bit sore, obviously, because you've had some fat removed and you've had it injected. So it's a little bit sore. I would say that soreness and that feeling of localized pain lasts about 48 hours. For me, I can't tell you what a relief it was because, I'd had injury upon injury and literally the pain, I was crawling the walls with it. I didn't know what to do with myself. I went to the consultant and when I first had it done, they said I was too old for an operation. And then the pain was so bad, I went to the consultant and he said, well, you've left it too long. It's been 2 years, it's retracted. And I can do it, but it's 50-50, I'm not sure. And he was quite nonchalant about it. And I just thought, well, surgery is quite a big thing and I'd have to be out of work for a long time. And then, as I said, my cousin had his therapy. And then I found you and then instantly you just put my mind at rest. I thought, you know what, rather than actually go through a fairly big operation, I would rather go and have something that's non-invasive and see how we go from there. But I am so grateful and so pleased that I did because even just a month on, I mean, even in my case, and I'm not saying this is for everybody, but in my case, even I would say 10 days to 2 weeks on, I could lift my arms up to where I'd never lifted them.
Yeah. I think it's important to stress also that rehab is extremely important with these procedures, just like anything.
Yeah.
Any procedure that you have, you really have to have the rehabilitation. And I also stress that. One of the things I also like to point out, this treatment is like really nothing new. The power of fat healing, it's been around since World War I. We know there was a famous surgeon called Hippolyte Mourstein, a French plastic surgeon, used fat to heal wounded soldiers.
Yeah.
So this is all this stuff that we're doing, even platelet-rich plasma. These are not new treatments. These things have been around forever. Yeah. It's just that it's repackaged almost, almost like good music. You know what I mean?
Yeah. It's like Apple updating. It's an Apple update. That's what it is. But it's been absolutely fantastic and it's really exciting, especially in the field of all orthopaedics or joint pain or injury. It's absolutely fantastic. Now, if people wanted to come to see you, they can book in for a consultation and then from there they can have the procedure. But please tell us where they can find you. And also what other treatments you do. We can come on and talk about them, but just give us an insight of what other treatments that you offer.
I try to do an array of minimally invasive non-surgical treatments, which are cutting edge. There are a few. There's one called 10X, which is a minimally invasive treatment for tendinopathies. There's, PRP, there's alpha-2 microglobulin. There's a whole array of treatments that we're going to be doing. The easiest way to contact me is on my call number is 0207-112-5400. That's 0207-112-5400. It's important to get a consultation so we can discuss the treatment because, to be honest with you, this treatment's not for everybody.
No.
Many people do need, there are some people who do need surgery. I think it's important to stress that if a orthopedic surgeon sees 10 patients, probably 1.6 or 2 people are for surgery. So there's a whole lot of people who are out there in pain who can benefit from minimally invasive non-surgical treatments. Again, I'm not against surgery, but if it was me, I would always try to do something minimally invasive first to see if it works, because it could very well work for you.
No, that's right. So with the MFAT treatment, how long on average would that last? The effects last?
Again, I always like to refer back to my dear friend Carlo Tremolata. When I first met him, years ago, 7 years ago, 5 to 7 years, he says, 5 to 7 years. When I came here to do it, I should say 3 to 5 years. But I'm starting to see some of the patients that I've done 6 years ago, start to say, hey, can this be done again? It can. It's your own cells, and it can be repeated. And if you can get, 6 to 7 years or even 5 years, that's a bargain.
Yeah.
If it's minimally invasive non-surgical treatment. So, yeah, I would say anywhere from 5 to 7 years. I'm almost inclined to believe more what Carlos says in terms of the length. But I think for me, even if you can get 3 to 5 years minimally invasive, that's a bargain.
Yeah, absolutely. I mean, and the thing is, if you can avoid surgery,
yes,
it's hardcore, having your body cut open and
Yeah.
and pulled about. So if you can avoid surgery, even better. But listen, if people want to see your work, what is the website they need to go to? And if you're on any social media, what is the social media?
Well, the website they can get me on is www.rrmg.com. That's Rogers Regenerative Medical Group.com. Now, that whole social media thing, I'm from a different era.
Listen, you're not far off from me, so I'm not having that one.
Apparently I do have social media, but obviously I don't do much on it, right? I've got other people who help me out with it, and I don't have time for that. I really want to stick to seeing my patients, and doing a lot of study and travel and learning. So the social media, you can get me via my website or just Google me or just call my phone number.
Okay, easy. Like old school. I like
old
that.
School. I like old school.
Yeah. I still use a pen and paper,
There you go.
But I know you have a Instagram handle because I'm following you, and it is Dr. Ralph Rogers. Oh, well, listen, it's so great having you on. Thank you so much. I really appreciate your time, and we will definitely get you back on talking about the other procedures and letting our listeners know all what you're about.
Thank you very much for your time. Appreciate it.
Thank you.
You're welcome.
That's it for this week's Good Vibes Only episode. But there's plenty more wholesome, holistic information where that came from. Check out Marie's website, www.mariereynolds.london.com, or follow Marie on socials. For Marie's products, follow at Marie Reynolds London on Instagram and Facebook, and at Marie Reynolds_London on TikTok. You can also follow Marie's day-to-day content on Instagram. Follow at Marie Reynolds_MRL. Thank you so much for listening to Good Vibes Only. If you've enjoyed this episode, we'd love for you to subscribe to and review the podcast wherever you listen to them. And remember to share the episode too. See you next time.